Welcome to Newspresso. Here is the top story in the past 6 hours. The longest U.S. shutdown wound down. The country hummed with the last tremors. It reflected a stalled democracy. The Treasury finally paid its bills. The streets were calm again. A new storm was brewing in health care. Trump stayed out of the negotiation ring. He refused to talk with Democrats about the ACA. He called it Obamacare, the administration's name. Now the clock ticks toward December. Both sides scramble to draft a health care bill. It may win a victory or spark a bitter showdown. The core of the debate is the subsidies. They have kept millions of Americans insured. This started in 2020 to offset higher premiums. They are due to expire on December 31. The numbers are staggering. More than 20 million people rely on them. A KFF poll shows roughly 3/4 support. They keep the enhanced tax credits. Half of Republicans say they back the subsidies too, though the number has fallen since the issue went hot. The Congressional Budget Office warns about subsidies. Extending subsidies could add nearly 4 million enrollees. The price tag would be $3 to $50 billion for taxpayers. Trump has been pushing a radical plan. He wants to redirect money. That money goes to insurance companies. He puts it into tax-free health savings accounts. In a recent Oval Office remark, he said, "They're going to go out and buy their own health care. We're going to forget this Obamacare madness." The idea is that by putting cash directly in Americans' pockets, people would make smarter choices about coverage and care. Proponents point to FSAs as a model. Senate Republicans say FSAs cover deductibles. They can also cover copays, dental, and eye care. Critics warn FSAs can't pay insurance premiums, so folks must shoulder monthly costs. The plan fears fragment as people drop coverage. Premiums rise for chronic patients, death spiral. Other attempts aim to tame the premium surge. The White House's Domestic Policy Council is studying a one-time rebate check for those who lose their subsidies, while Sen. Ron Johnson is reviewing marketplace rebate. Think tank leaders like Avik Roy are pitching a reinsurance fund to help keep rates down for the sick and chronically ill. Democrats, on the other hand, are pushing to extend the subsidies for at least a year, and some Republican members are willing to negotiate on fraud prevention and income limits. With the deadline set for mid-December, lawmakers will have to decide quickly. Speaker Mike Johnson says the GOP many ideas, but he also wants to avoid the political minefield that doomed the 2017 repeal attempt. Senator Rick Scott argues the ACA should be amended. The proposal is not abandoned, and that pre-existing conditions must be protected. Meanwhile, the Senate Health Committee chairman scheduled a hearing in late November to bring experts and lawmakers together. The stakes are high. If the subsidies are cut, millions lose insurance. Insurers could raise rates, and the political fallout could hit the GOP as the midterms loom. If the subsidies stay, the law will continue. Critics say the subsidies are a pandemic relic. They inflate insurer profits and distort the ACA. Either way, a vote is coming. The nation is watching. The next few weeks will determine whether the U.S. can move past the ACA's legacy. The debate will simply extend the policy's life in an endlessly patched form. The outcome will shape health care and the political future for years to come. Subscribe Newspresso. Never miss a major global headline.